just think it's incredibly important that you have a very effective patient and public voice in order to hold the system to account. And we only end up getting good services and responsive services and services that actually listen to what people want if you've got effective organisations like this. So I've been immensely impressed by what I've heard so far from Andy, and I congratulate everybody who's been involved, both the people who work for Suffolk Healthwatch, but also all of the volunteers that we were hearing about earlier. Your role is incredibly important in ensuring that in Suffolk people get the services that they need at their hour of need. So I wanted to give you my perspective on mental health, but I wanted to start by just reflecting very briefly on the state of the NHS overall, because it has an impact in turn on mental health. I don't know whether you heard the reports on the radio this morning. The phrase used was that the NHS is in a state of unease. This was a report from the General Medical Council. So we have to, I think, take this extremely seriously. It takes quite a lot for the professional regulator to say something of this sort, but it reflects genuine anxiety and concern about the state of the NHS. But I should also add the state of the care system as well. You will have heard a couple of weeks ago the Care Quality Commission report, where they talked about the care system being close to, and they used the words, tipping point. Now, when regulators start to talk in these terms, I think we have to recognise that the warnings that many politicians have been making, including myself, about the state of the system really have to be taken seriously. And at the moment we're facing, by 2020, a gap of funding in the NHS, according to most expert analysis, of something around £30 billion. The government says it's putting in £10 billion towards that, but the Health Select Committee, which is cross-party, has said that the figure actually is closer to £4.5 billion. And in the social care system, the Health Foundation has said that the funding gap by 2020 will be about £6 billion. Now again, councils have been given the right to increase council tax by 2% for social care, but that doesn't get anywhere near it. Raises about 1.7 billion by 2020 if every council in the country chooses to exercise that power. So we are facing what I believe is an existential challenge to the very system itself, the sustainability of the health and care system in this country. The truth is that if we are to have a sustainable system, we all have to pay more into the system. Now, we either do it through tax, and my view is that if we have to pay more tax, then we must be prepared to do it. If you don't want tax, then you have to think about co-payment. In other words, paying to see your GP. I think there are real concerns about that. Or you go for an insurance system with all of the negative aspects that involves. But we have to have this national conversation, and we have to have it now in order, in a sense, to achieve a new beverage settlement for the 21st century. And the consequences of not confronting it now is that we sleepwalk towards a disaster. And you can talk in abstract terms about the system crashing, but it's what it means for actual people that worries me. It means that elderly people not getting the care that they need when they need it, unless you can afford it, incidentally, because that's what we are heading to. My mum, before she died 2 years ago, got great care, but she could afford to pay for it. But I don't want to live in a country where you can get great care if you can afford it, but you don't get anything, or you are left waiting too long if you can't afford it. But that is the reality of what we are heading towards. It also means people with mental ill health, people with learning disability, with autism, people who are too often on the margins of the thinking of the system, they lose out whenever the finances are under pressure. And having been in the department, I've seen it myself. I've seen how it happens, how mental health loses out. And for me, that is intolerable, and it has to be confronted now. So that is my overall assessment of the state of the NHS and the care system and the urgency for doing something about it.